Hello, my name is Johanna Ospel. I'm a diagnostic and interventional neuroradiology fellow at Foothills Medical Center in Calgary, in Canada. And I'll be speaking at ESOC 2024 in Session SS11, Endovascular Treatment Frontiers, Where to Stop or Begin. This is a joint session with ESMID, and the topic of my talk will be, is there a pre-stroke disability profile of a candidate for no thrombectomy? And I'm actually quite curious and quite excited to speak about that topic, just because I think there's often a disconnect between clinical trial results on one hand and clinical practice and clinical reality on the other hand. Our randomized trials, especially thrombectomy trials, they quite often exclude patients with pre-morbid status. So MRS patients with MRS2 or higher are often excluded. There's often an upper age limit. But then if we look at clinical reality, stroke patients are old, they're comorbid, they often have pre-stroke cognitive impairment and so on. So those results from clinical trials can actually not be applied directly to our patient population that we treat every day, just because the trial population is very different from our actual stroke population. And I'll be talking about some strategies to deal with this disconnect, and also strategies how we could potentially accumulate evidence for those patients with pre-stroke disability. So there are many things that make ESOC unique. I think it's a very nice gathering of all kinds of people from different disciplines. There's neurology, there's also radiology, there's neurosurgery, there's stroke rehab medicine, who like to talk about stroke or to do research about stroke and treat stroke patients in their clinical practice. I think it is usually a more interactive meeting than many of the larger meetings. And this year's ESOC is especially unique for me, at least, because I did my training, my residency in Switzerland, in Basel, which is also where ESOC 2024 will take place.